This the evidence resources for policy-based development, please?
Yes, Dr. Mandil, yes.
Thank you so much. So in this presentation, we will try to ask ourselves two main questions. Where do I look for evidence to support policy brief development? What is considered to be relevant evidence to the problem in question? And then how are RCTs and systematic reviews critically appraised? Ladies and gentlemen, there are so many databases, what I'm sure all of you have used already globally, regionally, and nationally. And we also are proud that WHO has a lot of databases, again, on global and regional scales. On global databases, I'm sure all of you have used the Cochrane collaboration, the PubMed, the Ovid, Science Citation, as well as Gray literature. On databases of the World Health Organization, we have our observatories, we have our scientific journals, as well as WHO-supported surveys globally, regionally, and nationally. There's also many examples of national databases, such as the Saudi Digital Library, National Center of Health Statistics, healthcare delivery institutions, websites, etc. So globally, I am sure that you have all used the Cochrane library, and this is the single most reliable source for evidence, as you all know, which brings together in one place research on effectiveness of healthcare managements and interventions, and is considered by many researchers as the gold standard in evidence-based medicine, especially clinical researchers and clinical epidemiologic researchers. There's also the Campbell Library, which is similar to Cochrane, which helps people make well-informed decisions by preparing, maintaining, and disseminating systematic reviews in education, in justice, in social welfare. And it has now 5 coordinating groups: the social welfare, the crime and justice, the education, the methodologies, and other user groups. This is how the website would look at its landing page. And it had its World Summit this year. There's also the TRIP database, which is a clinical search engine designed to allow users to quickly and easily find and use high-quality research evidence to support practice and care. One of the universities, which is also very well known for these kinds of evidence resources, especially in evidence-based practice, is McGill, and also McMaster. And McMaster, as you all know, is one of the hubs for evidence-based medicine, evidence-based healthcare, evidence-based medical practice, as you all know, and I'm sure you have used their websites repeatedly. This is the website of the Health Sciences Library. There's also a very important resource, which is the Evidence Alerts, and this happens to be one of the best resources for new evidence for healthcare. And for the last couple of years, there has been COVIDent, which is the evidence network to support decision-making, and I strongly support and I strongly urge you to look at this website for its resources to support decision makers, support the public, researchers, products, and many, many others. And this is one of the most up-to-date websites you can think of. We also have the Harvard Kennedy School website for uniting research and practice. We also have what is known as the Dynamed, which is looking at the highest quality evidence-based information for guidance for researchers at different stages of the research cycle. Another very popular website is the UpToDate, especially for the clinical decision support. And I found this also a very useful website. Whereas also Evidence Aid, which actually is one of the very important websites to save lives and livelihoods in disasters by providing decision makers with the best available evidence and championing its use. I don't think anybody participating in this conference has not used PubMed. And as you all know, this comes from the National Center for Bioinformatics, the National Library of Medicine, the National Institutes of Health, and these are the hubs for what is known as PubMed.gov. And I'm sure all of you have used it because it's one of the most popular resources for recent evidence stemming from research on a global scale. There is another also very popular website, which is clinicaltrials.gov. And this is, again, under the NLM, or the National Library of Medicine. Again, I'm sure all of you have visited the website of the Centers for Disease Control and Prevention. And the interesting thing about CDC website is that it really addresses people of different backgrounds, professionally, socially, economically. If you visit the website as a scientist, you'll find it quite useful. As a layperson, you will find it friendly. And as a decision maker, you find a lot of information there, which could help health policy making. The IHME also in Washington State, on the western coast of the United States, has its own website, which is, again, one of the very useful websites, which you can find important burden of proof health studies, which support strong evidence, as you all know. Again, the Center for Evidence-Based Medicine is one of the oldest, hosted by University of Oxford, and I'm sure all of you are familiar with it and how useful it is in the development of the evidence-based medicine as time went by over decades, as you all know. One of the things which we tend to forget, especially when we are working in low and middle income countries, is the importance of gray literature. And here I'm referring to theses, I'm referring to dissertations, I'm referring to gateways, and the websites, names of which you can see on this slide. So one of them is called the ProQuest Dissertation and Thesis website. And this is really very important resource of gray literature. But WHO also has a lot of resources to share. I've referred in the beginning of my presentation to observatories, and our observatories are available on global, regional, and national scales. We also have our global journal, the WHO Bulletin, and we have CPGs, and also we have the hub, which is called the International Clinical Trial Repository Platform, or ICTRP, which is sort of a platform for primary clinical trial registries across the globe. In the Eastern Mediterranean, I strongly encourage you to visit our web pages, to use our Index Medicus for the Eastern Mediterranean, which I'm going to talk about, inshallah, in a minute. Our Eastern Mediterranean Health Journal, country profiles, which are available on country websites and on the regional web pages, as well as what is known as the Health Evidence Network of the European region of WHO. So this is the landing page of the Global Health Observatory. And here, this is divided into three parts: the universal health coverage, the health emergencies, and the health and well-being. We also encourage you to look at our web pages of the GRC, or the Guidelines Review Committee, which Dr. Rashidian is a member of. And this is the landing page of the ICTRP, which I was actually referring to. And from our region, we have three primary clinical trial registries. We have one in Saudi Arabia, one in the Islamic Republic of Iran, and one hosted in Lebanon. I would also like to refer to WHO's IRIS, which is the International or Institutional Repository for Information Sharing. And this is a global digital library for more than 70 years, having thousands of documents, which are the outcomes of our governing bodies on global, background, which is the World Health Assembly, on regional scale, which is our regional committee, and also technical reports coming from consultancies, inter-country meetings, technical series, CPGs, and the like. This is the landing page of IRIS. Wealth of information which you will find there. On a regional scale, we have our bibliographic databases, the health knowledge initiatives. Dr. Rashidian in the morning has referred to our late Mr. Hatem Nuruddin, who has been really very active in putting these websites and web pages together. Allah yarhamu ihsan ilayh. And also we have our epidemiology monitor and the Unified Medical Dictionary. The Index Medicus of the Eastern Mediterranean, ladies and gentlemen, is something the regional office is really proud of, with more than 275,000 citations for 900 journals from 20 countries of the region. And the reason why we're so proud of it is that many journals in our region are not actually indexed in PubMed. In fact, we think like 1/3 are indexed in PubMed, while the other 2/3 are not. But they are all available in what is known as the Index Medicus of the Eastern Mediterranean region. And we are also proud of our journal. Our regional director is actually the editor-in-chief. Dr. Arash and I work as the executive editors. And we actually invite you to visit our web pages. Alhamdulillah, we are in our 28th year now of this journal, which is issued on monthly basis. All our volumes, issues, and papers are available on our web pages as public access around the clock. You are more than welcome to visit our web pages and share the outcomes of your research for consideration for publication. Our web pages also include a lot of statistics on our regional health observatory. So we have a data repository, we have an indicator registry, and we have a framework for health information systems. So any information on morbidity and mortality in the region could be actually accessed by country, by variable, by disease on our web pages. As far as tobacco use is concerned, the outcomes of the surveys are also accessible on our web pages, such as the Global Youth Tobacco Survey, the Global School Personnel Survey, the Global Health Profession Student Survey, and what is known as GATS, or the Global Adult Tobacco Survey. This is available by country on our web pages. On a national scale, examples include the Saudi Digital Library, the Saudi Medical Literature, the Saudi Clinical Trials Registry. These are examples of national registries. We also have the Iranian Registry for Clinical Trials. We also have the Lebanese Clinical Trials Registry, and these are all available with the ICTRP, which I referred to earlier. In addition to the global and regional repositories of information and data, which I referred to, there are also country-specific web pages. And I share with you here the web links of some of them, but almost every country of the 22 member states in the region has its own web pages, which you are welcome to visit. This is the landing page of the Egyptian country, Lebanese country, the Saudi country website, and so on. So we spoke about the global, regional, and national sources of evidence for building policy briefs. We spoke about the WHO resources on global, regional, and national scales. And now we end by how to assess evidence when you reach it. So we have the types of literature resources, and you compare interventional versus observational, single studies versus systematic reviews, effectiveness versus traditional studies. I'm sure you're all familiar with that. the PICO analysis, and the CASP resources. And as you know, the PICO analysis depends on the population, intervention, comparison, and outcome. You're very familiar with that. Also the critical appraisal programs and checklists could be used that are available for most study designs. I'm only going to talk very quickly about the RCTs and the systematic reviews. If you want to actually assess a paper which actually reflects the outcomes of an RCT, you ask yourself 4 questions. Are the results of the trial valid? Is it worth continuing? What are the outcomes of the study? And will these outcomes help on a local or national scale? If you ask yourself the first question, are the results of the trial valid? You ask 3 questions. Did the trial address a clearly focused issue? Was the assignment of patients to treatments randomized? Were all the patients who entered the trial properly accounted for its conclusion? If the answer is no, then I don't think you should continue reading the article or including it in your study and building your policy brief. Then you ask yourself another set of questions. Were patients, health workers, and study personnel blind to treatment? Were the groups similar at the start of the trial? And aside from the experimental intervention, were the groups treated equally? And again, if the answer is no, then you stop here. But if it was yes, then you ask yourself questions about the results. How large was the management effective? How precise was the estimate of the management? And can the outcomes be applied to the local population in your own context? And were all clinically important outcomes considered, and whether the benefits are worth harms and costs? This is about RCTs. When it comes to systematic reviews, you ask similar questions, but in a different context. You ask yourself if the results, did the review address a clearly focused question? Did the authors look for the right type of papers? If no, then you stop here. But if yes, you ask another set of questions. Do you think all important and relevant studies were included? Did the review's authors do enough to assess the quality? And if the outcomes have been combined, and was it reasonable to do so? If the answer is no, you stop here. If yes, you continue and ask, what are the overall outcomes of the review and how precise were the outcomes? And whether the outcomes could be applied to local populations, and were all important outcomes considered, and benefits were the harms and costs. So this is, in a nutshell, what I wanted to share with you. We looked at the global, regional, and national resources for evidence to build policy briefs. We looked at relevant evidence to select policy options, and we also discussed the CASP review elements and checklists for RCTs and systematic reviews. For more information for what I've discussed with you this evening, afternoon, or morning, you please check these citations. Thank you very much for listening in.